Hey guys, welcome back to the Keystone Chiropractic blogcast. I'm Dr. Jonathan Chung. Today we're talking about a really important topic in today's society. We're talking about head injuries, specifically from concussions. Head injuries can be classified commonly as mild traumatic brain injury, and what that really means is someone takes either a whiplash or a blow to the head, and when that happens, the brain shifts and creates bleeding, and some type of a bruise happens into the brain. When that happens, it can lead to a lot of secondary problems. People will suffer with dizziness, headaches, inability to concentrate, and various pain syndromes. Now, most of the time, these symptoms will kind of resolve on their own, but in a lot of people, they actually start to become a chronic problem. And that's where the type of chiropractic that we do in this office with structural correction of the head and neck actually lead to a lot of great results for these types of people, especially if they played hockey, football, mixed martial arts, boxing, and even people with whiplash injuries. So let's talk a little bit about what's happening. When someone suffers either a whiplash, where their head jars forward and back, the brain can shift and actually create injury, or the other mechanism that most people are familiar with is a direct blow to the head, either from some kind of football tackle, a boxing glove if you've been fighting, or even if someone falls off a horse and hits their head. When that happens, inflammation will start to build up inside the brain. Now, this is the bottom of the skull. This is the top bone in the neck called the atlas. A lot of people don't realize that a hit to the head will actually cause a shift in this top bone in the neck. And if you look really closely, there's a little cable that goes through here. In a human body, that cable would actually be filled with arteries and veins called the vertebral artery and the vertebral vein. When the head shifts, it actually creates a kinking in those vascular structures. And when that happens, it can actually affect the circulation going in and out of the brain. Now, of course, we all know that circulation is critically important when it comes to the brain. When the blood can't drain properly because of the venous compression, the brain doesn't drain properly. It leads to a backup of fluid into the head, creating a condition that a lot of people have called normal pressure hydrocephalus. And what it actually does is it also backs up a lot of inflammatory molecules called cytokines into the brain as well, and that can also create inflammation in the brain and cause brain damage there. This is a big reason why people with chronic head injuries will actually start to have things like chronic concussion syndrome, and they'll actually start to have memory problems leading to things like dementia. And a lot of people are tying these head injuries to conditions like multiple sclerosis, Alzheimer's disease, and even Parkinson's disease. So what does that mean for your average person? Well, if you had a head injury in the past, no matter how big or small, you may have this problem starting to build up into your head and your brain, and that could lead to further memory problems down the road. This problem isn't always symptomatic, so that's why we always recommend an evaluation of the head and neck, even if you had a head injury or whiplash, no matter how big or small. Because getting this corrected early can prevent neurodegeneration, which could prevent a lot of chronic problems from happening in the future. So that's your Keystone Chiropractic blogcast for today. If you want to check us out, make sure to follow us on facebook.com/chiropractorwellington. You could also find us on twitter.com, Dr. Jonathan Chung. And you can always, of course, subscribe to our email newsletter and get monthly updates from Keystone Chiropractic. Have a great day.